I'm Paul Rivas, MD, and I'm the medical director and owner of Rivas Medical Weight Loss. Rivas Weight Loss has been around for over 30 years. And approximately 2 years ago, new medications hit the market as injectables. And the first one was called Semaglutide. And the function of Semaglutide really is to inhibit appetite through both a stomach GI mechanism and a brain signaling mechanism. No more cravings, no more stress eating. It's a remarkable combination of the two. What people really want to know about that is, what is it? Well, it's a once a week injection, and it's called a GLP-1, which means it acts on these receptor sites in your stomach and your brain. And then people want to know how much weight they can lose. That's hard to answer because it's very individual. I would say we're getting 15 to 20% of a person's weight off in the first 4 to 5 months. Now that's much better than the studies that showed 15 to 20% off in the first year, year and a half. How is that? How have we achieved that? We have people very personalized and customized. So they come in once a week. And once a week we talk about, is it working? Is it strong enough? Is it too strong? Is it too weak? It's very, very customized. And when you customize it per individual and per every week, which really there's no other program that does that, then you're going to get outstanding results because then we know exactly what to do for that individual. The other thing it allows us to do is we have a whole variety of medications. So let's say you're feeling that this is good but not great. Well, then we can add some of our older medications to it to make it great. The other thing is we must titrate it up slowly, and that brings us to side effects. So side effects are almost entirely GI or gastrointestinal. So that would include nausea, constipation, diarrhea, heartburn. And we can deal with those side effects actually, but the main way to deal with it is to titrate slowly. So the side effects are manageable. We have medications we can give if nausea is fairly severe. We have medications we can give if the constipation is fairly severe. Usually it's not a severe thing because we're so careful with titration. If you have a BMI over 25, you're considered overweight. But also, you have to remember where the danger is with weight. Like you might have a BMI because you're muscular, or you may have a BMI because your weight's in your hips and thighs, which isn't as serious. So I like waist size also. So if you take a measurement and put it around your waist, and if that measurement is greater than half of your height, you're a candidate. We are specialists in weight loss. It's all we do. It's all we have ever done. Whenever you see a specialist in any field, you want someone that has done this repeatedly. So we are having many primary care doctors now refer to us throughout all of Maryland because they just don't know how to do this the way we know how to do this. One huge side effect of these medications is cost. If you get these medications from your local pharmacy, it will cost you approximately $1,500 a month, and that's just for the shot. So that's saying to you, here's your shot, take it home, figure it out, give it to yourself, come back in a month, and we'll get a refill. We are substantially less costly than that, and that includes your weekly visits. So we make it as cost effective as we possibly can, probably more than anyone. We also like to be convenient. So we have offices virtually everywhere. It's important because I understand that people don't have much time in their day. So we're going to make it convenient that it's within 10 or 15 minutes of your house. We see you quickly in the office. We understand that your time is valuable.